Good morning, followers, friends, students. This is Dr. Jimmy Henderson again, PhD in psychology, and I was a volunteer counselor for about 35 years, working for NGOs. And I want to talk about something which is quite interesting. I've looked at a lot of counseling courses. I've done a few counseling courses. I've presented a few counseling courses over the years. And I find that there seems to be one problem, that they're not properly structured. You know, you learn the skills, you learn how to listen, you learn how to reflect, you learn how to explore, how to do options. But actually, at the end of the day, you can get stuck. I believe that you need a long process of stage by stage and with specific inputs and specific outcomes. So I have actually put together a book which I'll show you later on, which is doing very well at the moment. In fact, it's in use by an NGO here in Durban with a counselling course. And where I take you through 7 stages of the counselling process. And I want to go through them very quickly now, so that for those of you that are interested in counselling or are receiving training, or training centers themselves would make very good use of this book as well as this process. So let's assume now stage 1. Stage 1 is the initial meeting with your client. They usually come into the room in distress. And what's very important is the first thing is to establish a relationship of trust. In other words, that client has to see that you're interested. Through your words, you have to express empathy. You have to match their mood. In other words, if the client's in distress, you show your empathy through body language and through your words until that client feels relaxed with you and feels like this is someone I can talk to. So your first desired outcome would then be a relationship of trust, a positive impression of the counselor by the client. Then we move on to stage 2, which is called attending, where you actually start reflecting to the client, start talking to the client, and finding out their frame of reference. What is the issue? What's important to them? How they are experiencing the issue. And in other words, you're attending to them using certain skills. Once again, empathy, and you're starting to apply the proper listening process. Then we come on to stage 3, which is exploring emotions. Stage 3 is exploring emotions. And why we always start with emotions is because if the person's in distress or traumatized, then they're not thinking rationally. And you can't move on to the deeper, more complex processes of counseling until that person has reached some sort of catharsis, some sort of state where the tension has been released. So what you're going to apply during stage 3 is with careful listening, reflection, and empathy. Get the client to talk and express their feelings and their emotions. And you need to identify these feelings and emotions because you're going to work with them later on. Once you've achieved a certain outcome there, as I say, the outcome of stage 3, desired outcome, would be catharsis. The client looks better, starting to feel a little bit better about the whole situation and about you as well as the counselor. Then you can move on to stage 4. Now you'll find in practice these stages 3 and 4 are pretty much together. There isn't much. It can be the person will start talking about emotions and then go on to the thoughts and then back to emotions and thoughts. But for the purposes of counseling, you need to see the difference between the stages. So stage 4 would then be looking at the person's thinking, the self-talk, the kind of negative thinking that the client has, which is leading to this emotional response. And you need to look at those thoughts, make a note of them within the client's frame of reference. Remember that every client has a frame of reference, a certain perspective, and you may not see it. To you it might be not a matter, but to them it's a big issue, and it's affecting their lives. So you need to be genuine and concerned and understanding of that situation. So we've got to stage 4 now. What we're looking for outcome of stage 4 is the client is starting to get some understanding of their situation. A point where they settling down and becoming a bit more rational, and you can actually talk to them. So you need that before you move on to the stages, especially the next one of empowerment, of challenging. That client needs to be in a safe space. If the client is still traumatized, still distressed, you need to stay with them until you've sorted that out. So assuming the client is now starting to become more understanding, more rational, and you can talk to them almost normally, you go onto the stage of empowerment. And then you start tackling that self-talk, that negativity, as well as the negative feelings, but especially the thoughts, because the thoughts are what keeping the cycle going. So you look at the self-talk, what they keep telling themselves over and over about themselves, and you find it's genuinely or generally negative. And that negative thinking, that negative self-talk keeps the emotions going, keeps the pain going and everything. So during the stage of empowerment, you will try and look at the challenge a little bit. Look at the client's thinking and say, you told me this, but if you look at it in hindsight, if you look at it from a different point of view, you might see that this end of this relationship was actually useful for you, because there are benefits that you can't see now. You're feeling upset, but if you look at it from a different point of view, maybe in a few months' time you will see that it was actually beneficial to you. And that's called empowerment. In other words, getting the client into a better state of mind, which is where they can actually make decisions. So then you go on to stage 6, which is the option handling stage. You help the client look at different options and different ways of dealing with this particular problem. This is a very rational stage, and obviously once again remain within the client's frame of reference. And because, as I say, everyone's got a different past experience, everyone's got a different life situation. One cannot impose, as a counselor, impose a solution on a client. It needs to be from their point of view, from what is possible for them. So once you've got an idea that they've developed some sort of plan of action, you've actually done very well. And now you've come into the final stage, that of termination. Now termination is basically whether you're sending the client on their way, feeling empowered, feeling a hell of a lot better, but also with some ideas on what to do. And that could also include referrals. Very important. If the client has got medical issues, they need to be referred to a doctor. And if you've got those resources on hand, give it to them. Doctors' resources. Other institutions that may assist them. Churches, referring them to different institutions, NGOs, places where they can get further help. It might be an issue like dependency, and dependency, alcohol or drugs, and therefore they will need further attention. They might need legal help. Then refer them on for the legal help as well. That is your final stage of termination. And hopefully you'll have a client then who is prepared to leave and feels happy and feels a lot better than when they came in with you. So that is my 7 stages which I normally apply during counselling, and I found it very useful. And I'd like to show you my new book. As I say, it's a comprehensive guide to crisis counselling, the 2nd edition. It's actually been used now by this NGO in Durban as a recommended book for the counselling course. And I advise any of you, training centres, doctors, and any groups of people who are involved in counselling, who like to teach counselling or train counselling, get this book, because it's very, very useful for a training manual. Very useful, because I've got areas there on how to create support groups, how to put together a crisis team, suicide crisis teams, which I used to do back in the 80s. And I used to go out regularly at 3 o'clock in the morning and pull people from ledges. And all those experience gained from that is in there, and you'll find it very useful how to counsel groups of people together. You'll find this book very useful. A comprehensive guide to crisis counselling. It's available on Takealot as well as Amazon. So for you South African people, get this book. If you're thinking of opening a training centre, if you're thinking your students need a better book or a recommended book, please have a look at this book on Takealot or Amazon. You won't be sorry. Thank you for your time. digital, as well as my book on dealing with trauma, which is also available on the same platforms. This particular book is actually used by a local NGO, counselling NGO here in Durban, South Africa, and it's very, very good for training institutions, for universities, counselling centres, because it covers everything, all the stages of the counselling process. So I would recommend you, if you are busy with counselling or you want to start a centre or NGO, you need to get this book for your students as a textbook. Thank you. I want to thank you for your time, and then hopefully next time we'll deal with further stages of the counselling process. Thank you.